Uh, can't wait to hear from Dr. Daron Smith tonight. He's a graduate of the University of Alabama School of Medicine. He completed an internship in general surgery and residency in otolaryngology at the University of Louisville. And he's the co-owner of Queen City ENT, pictured here on the right with his partner on the left there, Dr. Richard Gillespie, who also implants Inspire devices at Queen City ENT. Tonight, Dr. Smith, take it away.
Alrighty. Hello, everybody. Tonight, we're going to talk about what is sleep apnea first. Apnea is the simple cessation of breath. So you're holding your breath. So if you do hold your breath, you got apnea. At nighttime, what's happening is you're trying to breathe in, but because of some upper airway obstruction, the air can't get to your lungs. When it can't get to your lungs, your oxygen levels are going to drop, and your brain's going to sense that drop in oxygen levels. And it's going to tell you basically to wake up. And that's going to happen sometimes over and over again throughout the night. This shows right here what happens when you have an apnea spell. The first little box shows after 47 seconds, oxygen levels they should start around 94 to 96%. And then you see it gradually dropping off. It drops off to a low of 84%. And what happens is your brain tells you got to wake up, you take a deep breath, make a gasping sound, and then the process starts over again. And you can see the second episode, after 86 seconds of not breathing, they drop down to a 74%. And what happens if you don't treat your sleep apnea? The first slide there shows that if you're waking up over and over again and not getting into your deep stage of sleep, that's when you get the most rest, and that's when your brain recovers, your body recovers. So when you wake up in the morning, you're going to be fatigued. You're not going to feel like necessarily going to work, and if you do go to work, you're probably not going to be that productive. Also, you can be a risk to yourself and the community. If you're sleepy, you're not going to be as good of a reaction time when you're driving, and you could, if you fall asleep at the wheel, kill you or somebody else. And the bed partner is also very unhappy. They're also not getting sleep, because usually people with sleep apnea snore very loudly. This can lead to marriage problems because the wife may have to leave the bedroom. There's also a problem with injury to your own body. The heart and brain hypertension is often associated with sleep apnea, increased risk of stroke, heart attacks, and they said memory loss. So what do you do about sleep apnea? Well, the first line of treatment is CPAP. That stands for continuous positive airway pressure. And this is either wearing some type of mask that fits over your nose, mouth, that keeps a positive pressure to keep that tongue and soft palate from collapsing backwards. Now, unfortunately, is not everybody can use this. Either they feel claustrophobic, they sometimes just wake up feeling smothered, and some people just say, I put it on, but I wake up in the morning and it's been off and they only used it for an hour and a half to 2 hours and they just don't remember taking it off. Some other options, there are oral dental appliances. And this is a device, usually only for mild sleep apnea, that moves the jaw forward a small amount. And that moving the jaw forward then moves the tongue forward and tries to keep your airway open that way. The anatomy altering surgery is much more invasive. This is where we're removing tissue from your throat, either your tonsils, part of your soft palate. There's other surgeries where we actually fracture the face and move it forward to move all of those structures forward. And of course, this is usually a very painful and a little more prolonged recovery time. So the alternative we're talking about tonight is Inspire. And you can see the little device, and you saw the video. And how it works is at nighttime, you have a remote, you activate the device. And what it's doing after about 30 minutes of falling asleep, every time you take a breath, it sends a signal to your tongue to stiffen up and move forward a little bit. This happens, again, with your breath. It's not a shock. You don't feel it. Your tongue is simply moving forward. So this is not going to wake you up every time you get an impulse. this one here. All right, so how is it done? It's done on an outpatient basis. You go home the same day. It's 3 small incisions. There's one tucked up underneath your chin, one a little bit below your clavicles, and then one kind of right underneath your armpit. And it's typically not a very painful surgery. Give you a little bit of pain medicine the first day or two, but typically Tylenol, ibuprofen takes care of the rest of the pain. You're limited in a little bit of restriction of your arm for the first 24 hours, and then you can start going to light activities. And usually we want full activities to about 20 to 28 days before we actually have you move in any excessive amounts. It typically lasts around 11 years, the battery. And when you have to replace it, it's not a big surgery. You don't have to do the whole thing. It's just that little implant in your chest. And that's a very quick, easy procedure. You can have MRI scans on your head, extremities, but unfortunately you can't do it on your chest or abdomen, okay? So if that were the case, it would have to be kind of deactivated and some of it removed. After the procedure, you go to your sleep medicine doctor. We don't activate it for a month. In a month, they turn it on, and they give you a range to play with. And you have an ability to actually turn it up and turn it down to a certain extent. After you get comfortable with it, you go back into this sleep medicine doctor and they do a sleep study and they fine tune it to get you the best results you can. They give you all the information that you need. Now, as far as the results, the initial studies showed that the people that they studied had an average of around 30 times an hour where they were stopped breathing. After Inspire, it went down to 6.2. Anything below 4 is considered cured, like the lady on the video. Sorry about that. Also, as far as snoring goes, it's initially 83% of bed partners complained of loud snoring. After completion of the surgery, it went down to less than 10%. And so that's where the bed partners really get happy. Just like CPAP, if you don't use it, you're not going to get benefit from it. But unlike CPAP, a lot of times, it looks like 94% of patients really like it, and they use it throughout the night. So an average of 5.7 hours is significant. This has been studied by numerous journals. Many papers are being written about it, and because of that, the insurance companies are are covering it now, Medicare, and some VAs and military hospitals. Now, is it for everybody? Not exactly. You have to have at least moderate to severe sleep apnea. Moderate is when you stop breathing 15 times an hour. And there was an upper limit, but now I think they're removing some of the upper limits of how many times. And you have to have tried CPAP. CPAP, again, is the first line. And if you get benefit from it, that's great. Now, you can't be too overweight. Some insurance companies, you have to be under a 35 BMI, and other ones, it might be 32. And if you want to know about your BMI, you can go on Google, put in BMI and put in your weight and your height, and it will calculate that for you. Right now, the age, you have to be over 18 to have it done. And I believe we're going to have Mr. Partlow talk to you now.
Yeah, thank you so much, Dr. Smith. As we transition, it was excellent, great clinical information, and very easy to digest. As we're transitioning to one of your patients who was kind enough to share his own journey and story, just give you some information on how you can get in contact with Dr. Smith at Queen City ENT. There's the phone number there if you'd like to book a consult with him. His Inspire Navigator is terrific. Her name's Casey. Her email listed there. They have 2 convenient locations in the Charlotte metro area, beautiful offices. There's their website if you like. If you have any detailed insurance information questions, you can call that number there below, and the VA questions as well, to that 1-800 number. Go ahead and advance, thank you. So Mr. Partlow is a great gentleman that was recently implanted and got his sleep study back, and was just thrilled with the results that he's gotten from the device. A little bit about Mr. Partlow. He was retired as a senior estimator for a big construction company and worked all up and down the eastern seacoast or southeastern coast. And him and his wife live in South Carolina. They have 2 grown children and 6 grandchildren. And just a little quote about that he shared with me that he'll go into in detail about his experience with Inspire. Mr. Partlow, would you mind taking it away from here?
Thanks for having me. Yeah, this before, as you were going through earlier with the CPAP and such, I was having wearing a CPAP. I was still having episodes of 27 times, I think it was, of stop breathing. And when I went through the sleep study to help with the qualification for Inspire, I was up over 31 times per hour with the episodes. I had this procedure done and couldn't wait to get it turned on after reading testimonies from other people. Got it turned on, noticed improvement the first night. I slept almost 8 hours through the first night. Next morning, the wife said, you didn't snore last night. So, and it's virtually stopped my snoring. So that's been a big plus there. But the big thing, I've got more energy in the daytime now than I've had in years. I don't fall asleep, take afternoon naps. I don't fall asleep watching TV. It's just been a blessing.
That's terrific. Thanks, Mr. Partlow. We really appreciate you sharing your story. And I know when you stop breathing that many times an hour, and then you go to stop and breathe in less than 5 times per hour, you're going to feel like a new man. That's terrific. Yeah. I'm glad to hear your wife got some of the benefit too with the snoring reduction. That's terrific.
And one other thing, before I had this done, I don't remember the last time that I'd had dreams. And since this has been activated, I think I dream every night now, and it's nice. Some of the dreams aren't quite what you would like, but at least I'm dreaming and getting restful sleep now. So that's the big thing. And yeah, taking it down, I think in my sleep study, if I sleep on my left side, it reduced it down to 0. And if I was on my back or my right side, it was like 2 or 3 times per hour, which, like I say, I'm cured.
That's fantastic. We had a couple of questions one in particular that I think you should answer, Mr. Partlow, since you're the only one here in the Zoom chat that has the device. And then we'll ask the rest of the questions to Dr. Smith. But what was the recovery like for you, Mr. Partlow, after the surgery?
The first couple of days, it was, tender and uncomfortable around the incisions. But I started after about 3 or 4 days, I got rid of the sling and was just doing normal things around the house. I did make a concerted effort to keep my arm down and not raise it above shoulder height as they instructed. And within 4 weeks, I was back, not lifting heavy things, but didn't have any problems. I think I took pain pill maybe the first night after that, it was just, Tylenol took care of everything. No problems. The incisions healed great. The one on my neck, you wouldn't even know it's there.
That's terrific. That's terrific. Thanks so much, Mr. Partlow. We have one question that I'll take, and then I'll ask the rest of the questions to Dr. Smith. Somebody asked if Blue Cross Blue Shield it covers Inspire, and the answer is yes. All Blue Cross Blue Shields, North Carolina, South Carolina, Tennessee, Virginia, all the ones around here in this region. So we have coverage with them. So thank you so much, Mr. Partlow, for making some time tonight to share your story.
Anytime.
And hope you sleep well tonight.
I will. I always do now.
Terrific.
Thanks for having
Dr.
me.
Smith, a few questions for you from the audience, and we'll round out the night tonight. Do your patients still need to wear a mask after they've gotten the Inspire?
No. After that, they're actually breathing through their nose and their mouth just like they should. Yeah. Nope. They're done with the CPAP.
That's terrific. That's terrific. Two other questions for you, Doc. Why do you think the BMI cutoff is 35?
Well, you can improve the anatomy a little bit, but if you have too much, if your neck is too thick and you have too much adipose tissue or fat tissue, it doesn't really matter if you move the tongue forward because the side walls are probably collapsing in. And so you have to get rid of some of that excessive weight for it to, if you're stop breathing 65 times an hour and the Inspire will only get you down to 20, well, you still have sleep apnea and you're still not going to feel great. So that's the reason for the cutoffs there.
That's great. And then the last question, besides Mr. Partlow, what type of outcomes are you having from your other patients? What are you seeing?
Well, the ones that I've seen so far, they've all been below 5 or 4. So they're, in a sense, cured right now.
That's terrific. That's terrific.
Yeah.
Well, a good meeting ends on time. A great meeting ends early, and we are on time. Actually, if there's no other questions, we're going to adjourn for the night. I just want to thank everybody for joining us tonight on this discussion with Dr. Smith and Mr. Partlow. And if you have any other questions, feel free to reach out to Queen City ENT at one of their 2 locations, and they'll get you set up. Have a great night, everybody, and thanks for joining us.
Thank you.